All right, I'm going to get started. We still have some people that have not signed in yet, but we can get this thing started, and they can pick it up as we get going. We'll do a little the introduction portion first. My name's Doug Lubenow. I'm the president of Senior Advisors. Also working with me doing the seminar is Justin Lubenow, who is vice president as well as partner in Senior Advisors. I've been in this business. I've been in health insurance for just over, 31 years. And Justin joined us about 6 years ago, and he's been specializing in Medicare also. I'll do the first half of the seminar, and then he's going to jump in and do the second half of it. We do encourage you, if you want to follow us on Facebook or subscribe to us, you can do it. Today, all that today is an educational seminar. We're not here to sell anything. We're just here to educate you on how Medicare works, what you have to do, and the important thing to sign up for Medicare. What we do ask is when the time comes that you would use our services, the only way we do get any payment is if we sell, Medicare plan supplements or drug cards for the insurance companies and they pay us. There is no fee to call our office. So if you have questions and you ever want to just sit and ask a question, feel free to call us. There's not going to be a charge. There's no fee that we charge for phone calls. I get phone calls. I work with a lot of major companies. Today, I want to welcome a number of people from the American College that joined us today for this seminar. So my service to them is that I'm willing to take phone calls with there's no charges, and just to answer your questions. And hopefully at some point down the road, when the time comes, you'll think of us and let us help you get set up with your Medicare benefits. All right, so I started in health insurance, group health insurance 31 years ago, and probably about 12 years ago, I got involved with Medicare, actually close to 15. But we started Senior Advisors in 2009, which is our division that just specializes in Medicare plans. We have basically 5-star reviews, and if you go on our website, you see a lot of testimonials and 5-star reviews from our clients. I think it's one of the things we do is we really like to service our clients. We have 2 offices in New Jersey, one in Cranford, that's where Justin works out of, up in the northern area, and I'm down in Moorestown, right next to Philadelphia and South Jersey. But we just opened in the last 3 or 4 months an office in Phoenix, Arizona. I was just out there last week. My daughter-in-law is running that office in Phoenix, and it's doing really well out there also for us. We are licensed in over 30 states in the United States. So we're able to help people up and down the East Coast and throughout the country. In most states, we're able to help people. And we're getting a lot of people that relocate to Florida, the Carolinas. If you're in Pennsylvania, Delaware, we're able to help you in just about, most parts of the United States. We work with all the major insurance companies. We work with Aetna, Cigna, Mutual of Omaha, Horizon Blue Cross, United Healthcare, and many more companies. We help you explain what you have to do to get enrolled in Part A and Part B of Medicare. Then we explain how Medicare plans work and Medicare Advantage plans. And then very importantly, how the prescription drug card, which is Part D of Medicare, how that works. And that's one of the most important things that you have to know, how to get the right drug card. So today we're going to talk about Medicare and how it works with Medicare supplements, the prescription drug card, Part D, and then we'll recap it at the end of the biggest mistakes that we see people making when they go into Medicare or they don't go in properly into Medicare.
Just a quick comment for folks out there, if you have questions throughout the presentation, feel free to type your questions into the Q&A. There's an option at the top or bottom of your screen in Zoom.
Hey, Justin?
Yes.
Justin, are you talking? There's no sound coming out from you. Go ahead. No, do it again.
Can you hear me?
Yeah. You know what? I had my volume turned off.
Okay. All right. So for folks out there that have questions, just use that Q&A button at the top of the screen, or it might be at the bottom of your screen. You can type in your question, and we'll answer those throughout the presentation. So thank you.
Thanks, Justin. Sorry about that. All right, so here's the different parts of Medicare. You got Part A and Part B, and that's what you have to get from the federal government. Part A is hospital inpatient care. So for going into hospital and skilled nursing facilities, that's under Part A of Medicare. Most people don't have to pay for Part A. If you worked 40 quarters in your lifetime and paid into the Medicare system, you don't have to pay for Part A. The government gives you Part A. Part B is the part that you do have to apply for, and you're going to be paying the federal government for that. We're going to talk about what it costs to get Part B. Most people pay this year $148.50, but there are several income brackets that can affect that, where you could pay more money for that. Now, Part B of Medicare covers everything outside the hospital. So it's all your doctors, all your tests, your labs, MRIs, CAT scans, very expensive items like chemotherapy, radiation treatments, infusion therapies that can be $10,000, $20,000, $30,000 per month. It's all under Part B of Medicare. So whatever you do when you retire, you're going to have to get both Part A and Part B from the federal government. That's a very important step that you need to know. Now, Part C of Medicare, Part C is a whole different way of getting covered under Medicare. Part C is sold by an insurance company. It could be Blue Cross, it could be Aetna, it could be United Healthcare. And it's more on the line of an HMO plan, and it differs dramatically from using your Blue Cross card. You no longer would use from your Medicare card. You would not be using your Medicare card if you had Part C. You'd be using the insurance company's card, and the insurance company would be covering all your expenses. Those plans are totally different. We're going to get into the differences of if you had a Part C Medicare Advantage versus using your original Medicare card and a Medicare supplement plan. And the Part D, you buy Part D from the individual insurance companies that sell the drug cards. You do not get Part D or even Part C from the federal government. You're going to buy those from the insurance companies that sell a drug card or sell Medicare Advantage plans. And there's different, costs for the premiums, and we're going to go into in-depth presentation on how you get the right drug card and the expense of getting a drug card, and again, the mistakes that people make when they select a drug card. So this is what you have to pay for your Part B, and it is income adjusted. So if you're single and filing your taxes, for example, this year, 2021, they're going to look at your 2019 tax return. And if you're single and you reported under $88,000, you would pay $148.50 a month to get your Part B. But if you're married filing jointly and under 176, you'd pay the $148.50. Now, as the income goes up and you're over 88,000 or over 176,000, you will start paying the government more money for your Part B. As you see, it goes up to 207, and the next bracket's 297. Next one is 386, and then 475. If you're over 330,000 as a couple, or 165,000 as a single, you'll pay $475 for the Part B. And the top bracket is if you're over $750,000 or 500,000 as a single, you're paying $504 a month for Part B. So this is a shock to people at times, but they didn't realize this when they get the notice from the government that, oh, your Part B is going to be, $500 a month, and for each a husband and wife. Husband and wife pay the exact same amount if they file jointly. Whether only one had the income, they pay the same amount. The government has also decided, goes back at least 8 years ago, that they're going to have to charge an income adjusted amount. Also in the drug cards, if you're under 88,000 single or under 176 as a couple, you only pay the premium on the cost of the drug card from the drug card company that you're purchasing the card from. If you go in over 88,000 over 176, you're going to pay an additional income adjusted amount. It starts at $12.30 and it goes up to $31, $51, $70. And this is over and above what you'd pay for the Part B income adjusted amount. So you would have a total amount on the next page. You'd have a total amount on your Part B and your Part D income adjusted amount. The base is going to be $148. You're not going to pay extra. But as you go up, it could be $220 a month. If you're over 222 as a couple, it'd be 328. Over 276 or 138 over 138 single, the 165 at 437. And then the next bracket is if you're above 165,000 as a single person or 330 as a couple, you'd pay $545.90 per month for your Medicare B with the income adjusted amounts. Okay, so that's a very important thing that you understand that. And we will tell you, this is based on your tax returns from 2 years ago, your modified adjusted gross from 2 years ago. If you're making over 330,000 and you're saying, well, wait a minute, I'm retiring, I'm not going to make over 330,000. You have the right to appeal this. Well, you'll get a letter, and you'll get a letter from telling you what it is, and it says if you disagree with anything, you have 60 days to appeal it. So this is the format you would use to appeal it, and you would send it back. Work reduction, loss of income, a divorce situation. There could be several reasons why you're not going to make over 330,000 anymore. And you might be below the 176 as a couple. And you don't want to pay $545 a month if your income is going to drop because you're retiring and you think it's going to be down, so you appeal it and have them bring it down to maybe the 148 a month or lower than it would be at $330,000 in income. So you don't pay that for 2 years before it would get corrected through the system. So definitely you got to keep that in mind, and you have the right to appeal the amount they're going to charge you for Part B. All right, so when should you apply for your Medicare benefits? There's a 7-month initial enrollment period, and it starts the month that your first month of eligibility is the first of the month that you turn 65. So in this example, the birthday is September 10th. So September 1st, you're eligible to start Medicare. So you can enroll 3 months before to get this. And so June 1st, anytime after June 1st, anytime in the month of June will be fine to enroll and get your Medicare benefits in place for September 1st. So everything is set up and you're all set to go for September 1st. I will say, if you're still working and you have group health insurance and you work for a company with 20 or more employees, you do not need to sign up for Medicare at this point in time if you don't want to. There's no penalty as long as you have group health insurance and your company has 20 or more employees, and people are retiring now a lot later than 65. And people are working to 68, 69, 70 years old. So you wouldn't apply, if you're retiring at 70, that's when you would be applying for your Medicare when you retire and you're losing your group health insurance. And we'll get into that in a minute on what you do. You also have a window beyond the September date that you go 3 months after your birthday, which would be the end of December, that you could also be in the initial enrollment period that you can enroll. Now, right now, the law is a little screwy. Every month that you wait after September in that example, you're going to wait an extra month to get your Part B. So if you wait till the very end, 3 months after, and you enroll, they're going to make you wait another 3 months. So basically, you're not going to get your Part B until 6 months after your initial enrollment period. This is, we have so many people that caught up in this. They want to work beyond the age of 65. Something happens 2 months after they're 65 years old. We've had people get laid off. They call us, I got to go on Medicare. I just got laid off. I need to get Medicare next month. Well, if you're 2 or 3 months after your birth date, you're not going to get it next month. They're making you wait 2 or 3 months longer before you can get your Medicare benefits. And this has been a situation that Justin and I have been going to Washington for almost 30 years lobbying on healthcare reform. And I was a member of the Medicare Advisory Board with our association, the National Association of Health Underwriters, of which I was on that board for 4 years. Now, Justin's been a member for the last 5 years. We've been fighting this issue all this time. We do have some good news to report right now on this whole thing, that last week it was announced in one of the acts that was approved, the Consolidated Appropriation Acts of 2021, that we finally got this thing corrected. It will not go into effect until January 1st, 2023. But once it goes into effect, you'll never end up in this position where you could get hurt because you're 1 or 2 months after your enrollment period, because you will get effective the month after you enroll, and they're not going to delay you. And as I said, anything that goes on in Washington, it could take years to get a simple change like this. Everybody in Washington looks at you and agrees, yeah, that's a stupid rule. I don't know why we do that. And then you leave and you think it's going to happen. And now we got it approved maybe 4 or 5 years after we started lobbying in Washington to get this rule changed. So this is a major improvement that people won't be hurt anymore starting in January 2023. So who has to apply for Medicare and who doesn't? If you're working in a smaller company with less than 20 employees, Medicare is primary in companies less than 20 employees. So it's very important. You're approaching 65. You only have 10 employees, not people on the health insurance, but 10 actual employees on payroll. You better get your Medicare A and B signed up for your effective date when you first turn 65. Or else the insurance companies like a Blue Cross will say, wait a minute, we're not paying your claims because you're supposed to have Medicare. Medicare is supposed to pay 80% of these claims. We'll only pay 20% of the claims. So again, if you work for a small company, less than 20 employees, you have to have Medicare when you turn 65. In situations like that, we usually recommend you look, and it might be better to go on Medicare and not even stay on the group health and plan. Just to, take Medicare might save you money, and you're gonna have much better coverage. If the company has 20 or more employees, which you're working for a company with 20 or more employees, your group health insurance is primary. So you can stay on the group plan and you do not need to get your Medicare. You can sign up for Part A if you want. I mean, there's nothing wrong with that. A lot of people have their Medicare card with only Part A on it. So there's nothing wrong with getting the Part A. Once you turn 65, but don't sign up for the B if you want to stay on the group health insurance plan. Sometimes, again, if you have a high deductible plan and you're out of pocket at $5,000 for a husband and wife, $6,000 deductible, and you have that deductible, maybe it might be better. Hey, I'm going to go on Medicare. I don't have that $6,000 out of pocket. So these are the types of things that we discuss with people. How much are you paying for the group plan? How much out of pocket do you have? Do you hit your deductibles? If you have a lot of out of pocket and you're paying a lot of money, maybe Medicare might be better for you. A company cannot force you to come off the group health insurance if you work in a company of 20 more employees. It's against the law for a company to force you to drop your group health insurance. It's up to you that you have the right to drop off at 65 and go on Medicare. It's your choice to do that. Another question that comes up a lot is a spouse. And my spouse is turning 65 and, they're on my group health insurance and it's costing me $300-400 a month to have them on the group health insurance, sometimes $500 and $600 a month. Well, if it's that much money, maybe you should look at Medicare also for the spouse. So that's another type of discussion that we have with people. And again, there's no charge to give us a call and we'll discuss that with you. Here's a change. If somebody's disabled and you have Social Security disability and the employer has less than 100 employees, Medicare is primary. So again, that's a big change. So let's say you have a spouse that's on Social Security disability, you work with a company less than 100 employees, that spouse better have Medicare A and B as their primary health insurance and don't rely on the group. Now, if the employer has 100 or more employees, they can stay on the group health insurance and they don't have to take Part B of Medicare at this point in time, just stay on the group health plan. If you do retire and you go on an employer's retirement plan, and you're entitled to Medicare, Medicare is always primary on retiree plans. That's another thing that you have to be aware of. Hey, I'm still on the group health insurance. I'm retired and get my group health insurance. Well, no, you're no longer actively at work and Medicare is primary and you can stay on the retiree plan and they're only secondary to Medicare. And the other thing that is very important to know, if you go out and you're retired and you elect COBRA and you say, well, I'm going to take the COBRA benefits, Medicare is still primary. If you're over the age of 65 and entitled to Medicare, you have to have Medicare, even if you're on COBRA. It almost doesn't make any sense to stay on COBRA if you're over 65. When you get a Medicare Part B and a supplement for far less money and have better coverage, to just go on Medicare once you retire. Okay, so these are a couple of different scenarios. if you turn 65 and you're already enrolled in Social Security, if you enroll in Social Security, let's say 62 years old, you will automatically be sent a Medicare card with Part A and Part B on it. Now, if for some reason you don't want Part B at this time because you still have group benefits through a spouse or yourself working, you have to decline the Part B and send it back to them and say, hey, I don't want Part B now. Don't start taking money out of my Social Security check because, I'm still working. I don't need your Part B. So you do have to keep that aware of that if you're already collecting before the age of 65. The other thing I didn't mention, I think I missed, is that if you have a spouse and they're on your group health insurance and they're eligible for Medicare, the spouse would also be going back. If its company has 20 or more employees, the spouse is also considered coverage with the group health plan, and the spouse doesn't need Medicare either if the company has 20 or more employees. But if there's 20 or less, then the spouse is also going to have to get Medicare A and B. So it works both ways for a spouse and the employee. So if you're 65 years old and you have not enrolled in your Medicare yet, you can do this online at socialsecurityadministration.gov, which is ssa.gov, and it's /benefits/Medicare. Or if you just go to I just tell people, go to the homepage for ssa.gov, and right on the front homepage is a block. It says apply for Medicare benefits. Click that, and that'll take you right into the Medicare enrollment system where you will enroll in your Medicare Part B. And it takes about 3 weeks for the government to get you set up in Part B after you enroll. Then you'll get a letter from Social Security saying you're all enrolled. And a week later, you get your Medicare card with both Part A and Part B on it. If you're over 65 and did not enroll because you're still working, you say, well, I'm not going to enroll, I'm still working. So you don't enroll. What do? How do you get enrolled? You can no longer go online and do it because the government wants to see proof that you've had group health insurance. So what you do is a one-page form that you bring to your employer, and it's just proof of employment. There's actually two forms. The one on the left here, it's just your request to start the Part B. So you just send that in with your proof of previous coverage and request if you want, like we're in the month of April, I want May 1st or June 1st. You put down, if you don't want May 1st, you put on there in your remarks section, I want June 1st effective date. And then you'd have from your employer filled out the dates you've had group health insurance. So you just have to prove to Social Security that you've had group health insurance, and they'll give you a Part B whenever you want. And there's no penalties at all. We get phone calls all the time. Oh, my friends say I'm going to be penalized if I don't sign up for Medicare. I got to sign up for Medicare. My friends are telling me. No, you don't have to sign up. You can sign up for Part A if you'd like, but you're not going to be penalized at a later date. You could be 70, 80 years old. I had a professor at University of Penn retiring at 80 years old. He got his Medicare at 80. His wife was 78. For the first time, they just got Part B of Medicare. So no penalties, but you have to show proof. And this is the form. We have the form. We can send forms out to you if necessary, so you can bring it to your employer to have them complete that one-page form. And if your husband and wife's doing this, you both need a form. The spouse is the dependent on your group health insurance, and you're the employee. So you each would need a form that has to go into Social Security to get set up with Part B. All right, so we're going to discuss a little bit the differences about staying with original Medicare. So you sign up, you get your Part A and your Part B Medicare card. It's also advisable. This is the left-hand side of this chart that we're looking at. And then you should get a Part D drug card. And people say, well, I don't take any prescriptions. Why should I get a drug card? Well, if you don't take a drug card when you're first eligible, you will be penalized by the federal government at a later date for not having a drug card. So it's very important that, you get a cheap drug card just to protect yourself. You don't know if you're going to end up with any prescription, but you'll never be penalized as long as you have a drug card of some sort, that'll cover you. It's got to be a credible drug card. So just get a Medicare Part D drug card and you'll be all set going forward. And you can change that drug card once a year. So you're not stuck with the card that you select in the beginning. And then it's also very advisable that you get a Medicare supplement policy to fill in all the gaps. It's called a Medicare supplement or a Medigap policy to fill in the 20% not covered by your basic Medicare card. So the other option is you go to the right-hand side and you say, well, I'll get a Medicare Advantage plan. Okay, you go to the insurance company, you go to Blue Cross, you go to Aetna, Healthcare, and you sign up with them. You will no longer use your Part A and Part B Medicare card. You do have to have both A and B to get a Medicare Advantage plan, but now you're going to be with an insurance company. That insurance company takes control of your healthcare. It's a managed care plan, and you have to, go to that company. Whatever you do, what happens is the government gives the company, let's say, about $1,000 a month per person, and then the government tells Blue Cross, hey, they're your responsibility. You pay all their claims from here on out. So Blue Cross can definitely manage your care and say, well, you need an MRI, you have to get it pre-approved. Well, you know what? They could say, well, we don't think you need the MRI. Or you need some type of surgery. Well, we want you to get physical therapy first. We want you to do something else first. We want you to do more of this before we allow you to get an MRI. They have the right to do that. And they will do that because you're being managed by them, and they don't want to spend money on a claim if they don't have to. You use that Medicare card, you can go any place you want and be covered, and nobody questions you. You need a test, you go do the test. You need surgery, you go do the surgery. Big difference, big difference. So the next slide will show you some of the differences. So what's the relationship with A and B? You need a supplement if you're going to use your Medicare card, your red, white, and blue card with Part A and Part B, then you need a secondary Medicare supplement, Medigap policy. Medicare Advantage replaces it. Do you have a private network if you use Medicare? No. Every hospital in the United States takes Medicare. You don't have any referrals. You can go right to specialists. With a Medicare Advantage plan, you have a private network. If you go to Blue Cross, it's in Blue Cross Medicare network of doctors, ARP, which is United Healthcare. They got a subset of doctors that take their Medicare Advantage plans. So it's not the same network that would take United Healthcare or Medicare doctors. It's doctors that are signed up to accept the Medicare Advantage plans. Referrals required. There's no referrals with Medicare and a supplement. Some of the Medicare Advantage plans, you do have to get referrals. A lot are open access now, and you don't need referrals on most of the plans now on Medicare Advantage. You can go right to specialists. Your Part D is not included with original Medicare. You have to get a separate Part D drug card. It is included on most of your Advantage plans, so it's all bundled. With Advantage plans, you have one card, and that's the one card for the doctors, for your drugs, for the hospital, whatever you do. With Medicare, you got your Medicare card, you got a supplemental card, and you got a drug card to use. Monthly premiums, they're usually higher with Medicare supplements. Medicare Advantage plans, and most of them are lower. I have seen some Medicare Advantage plans that are more expensive than supplements, which would be absolutely ridiculous to spend more money on a Medicare Advantage plan when you get a much better coverage with a supplement in Medicare and a supplement than with a Medicare Advantage plan. Some Medicare Advantage plans are actually, they advertise them all the time as zero premiums. Oh, no cost, no cost. Well, yeah, but they don't tell you the whole story. They don't tell you about what happens if you get sick. With a Medicare card and a supplement, you have very little out-of-pocket expense. You don't have to worry about thousands of dollars out of pocket if you get sick with Medicare and a supplement. With a Medicare Advantage plan, you can have up to $7,550 is the max allowed under federal law on an Advantage plan. And how do you get up to $7,500? Well, you have copays. I mean, you might have a zero copay at a primary and $30 or $40 at a specialist, anywhere from $300 to $400 per day if you get admitted to a hospital. A test could be $100 to $250 for a test like an MRI. The big items are infusion therapies, which you're only covered at 80%. So chemotherapy, radiation treatments, you're only covered at 80% on an Advantage plan until you hit the $7,500. So I've had people come into my office in the month of September and they say, get me out of this thing. I say, why? I said, because I was diagnosed with cancer. I said, well, you're going to hit your $7,500 because 20% of chemo, you're going to hit that in 2 or 3 months. And then guess what? In January, you're going to start all over again because you're still going to be on chemo and you're going to hit $7,500 again in the first 3 months of the year. So within 4 to 5, 6 months, you're going to be out of pocket $15,000 because you got a Medicare Advantage plan. Well, get me out of this thing. Well, the most important part of this thing that you have to understand, this seminar, you could be making a lifetime decision here. If you pick a Medicare Advantage plan and you do get sick at some time down the road, people all the time say, hey, I'm healthy. We don't even go to doctors. We're healthy as could be. You know, this Medicare Advantage plan is great for me. And then you get sick. And then you say, well, get me out of it. You have to go through medical underwriting to get a Medicare supplement at a later date. And if you have something like cancer, if it's an ongoing situation, nobody will take you with a Medicare supplement at that point in time. Usually you have to be free and clear of cancer for at least two, in some cases, 3 years with no more treatments. And then you could apply for a Medicare supplement if you're free and clear for 2 to 3 years. Depending upon the insurance company, they might consider to take you. But in the meantime, you're going to be stuck with that Advantage plan through all your treatments for your cancer. Guaranteed renewable for life. You buy a Medicare supplement, nobody can take it away from you. It's guaranteed renewable for life. A Medicare Advantage plans, they change every year. In the fourth quarter of the year, you'll see more TV advertising for Medicare Advantage plans. It actually drives you crazy. It drives me crazy because I'm in the business. And all I see on TV is, you know, Medicare Advantage, and Joe Namath. I see, if Joe does another year of advertising, I don't know, they got to get somebody a little younger than Joe Namath, but he's out there saying, oh, this is the greatest thing in the world. Well, you know, Joe, you don't have that coverage, but you're telling everybody else to get it. But anyhow, so those are the major differences. I am biased towards supplements. I personally have close to 3,000 clients on Medicare supplement plans. And maybe, I don't even think I have 50 people on Advantage plans. And I never get complaints from anybody on a supplement. The people that have gotten sick and they don't pay a dime and they go to the best hospitals in the country, they can walk in, be treated for their cancer or any other problems they have, physical therapy, they don't pay anything. They're 100% covered. They say, Doug, this is like unbelievable. Just go in, show my Medicare card, my secondary card, and I don't pay a dime. So I like having that. I can sleep at night because all my friends have Medicare with a supplement, and some have come down with cancer, and I don't have to worry about them coming back at me saying, hey, boy, this is junk that you sold me, and I got thousands of dollars out of pocket. So I am a little biased towards keeping your original Medicare card and a Medicare supplement. And let you know, they both pay us a commission. The Medicare Advantage plan actually pays us twice as much money in the first year you buy it than a Medicare supplement does. So there's agents out there, a lot of them just want to sell Advantage plans because they're paying you twice as much money. Why wouldn't you sell Advantage plans? Well, I don't care how much money somebody's paying me. I want to do what's right for our clients. And we find out if you do the right thing, you know, it comes back and you pay dividends for doing the right thing. So this is how Medicare works with a supplement. Plan F was the best supplement since 2010. The government has canceled this plan as of January 1st, 2020 for newly eligibles to Medicare. It is still available for people over the age of 67 now that have been retiring at 68, 69, 70 years old. They can still get an F. It's still available to them, and the pricing is pretty good that they might want to consider it. There's a minor difference between this and the next best plan that's out there, and we're going to discuss it right now. If you just go in the hospital with your Part A Medicare card, that's all you have is Part A. You don't have a supplement. There's a deductible. It's $1,484 each time you'd go in the hospital. Then there's a copay after 60 days of $371 a day not covered. And it goes at $742 a day after that. That's not covered under your basic Medicare. You only get 90 days under basic Medicare. You get a 60-day lifetime reserve. That's all you get under Part A. And you could definitely stay a lot longer than that with a major sickness. I've had people in the hospital 8 months, 9 months. So it can happen. The reason you get a Medicare supplement, the supplement pays the deductible, pays the copays. What do you pay? Go to the last column, the green column. What do you pay? You don't pay a dime. You can go to any hospital in the United States, you're 100% covered. You want to go up to Sloan Kettering in New York because you have a special type of cancer. You want them to talk. You want to go there just to talk to somebody. 100% covered if you had to go to Sloan Kettering. Any hospital in Philadelphia, all over New Jersey, you're fully covered. If you get transferred to a skilled nursing facility, they would say, all right, we're going to move you from the hospital bed and put you in skilled care. As long as you've been in the hospital for 3 days or 2 overnights, you'll be covered 100% under Part A for 20 days. The next 80 days, there's a copay of $185.50 a day, and your supplement plan pays that. So you can be covered for 100 days in skilled care and not pay a dime. Now, another major difference between this and Advantage plan, the Advantage plan has to cover the first 20 days, the same as Part A Medicare. But after that, you're going to be on the hook for the $185. Some cases, they charge you $150 to $185, but you're going to pay that per day on the Medicare Advantage plan. The other thing that's important to note is you can go to any skilled care facility with basic Medicare. They all will take you. There's only a select few skilled nursing facilities that will take you in the Medicare Advantage plan because they tell us we can't get approvals from Medicare Advantage companies to treat you. And we deal with Medicare every day of the week, and they approve everything we want to do. These Medicare Advantage plans won't approve things, so we won't even take you. And you can be limited to go to less than the best skilled care facilities with the Medicare Advantage plan. That happened to a personal friend of ours. I had cancer, and his wife wanted to put him in a skilled care facility in Florida, and he had a Medicare Advantage plan. I didn't sell it to him. He bought it on his own in Florida, and his wife could not get him into a decent skilled care facility to treat him with his cancer. It was horrible. She was so mad that she couldn't get him into a nice facility. Anyhow, that's another point. So that's Part A. Part B of Medicare. There's a deductible on a small deductible. It's $203 this year under Part B. Your supplement Plan F will pay that. Then Medicare, once they pay the $203, Medicare starts paying 80% of all your charges. The supplement pays the other 20%. So what do you pay? Again, look at that third column. Look at that green. You pay nothing. You walk in the doctor's office, show your Medicare card, you show your supplemental card, you don't pay a dime. It also covers F. Well, there's only two supplements, Plan F and then Plan G I'll talk about next. Excess charges. If a doctor does not accept assignment, he has the right to bill you 15% over and above. Pennsylvania does not allow excess charges. Other places do. Northern New Jersey, central Northern New Jersey, there's doctors that will charge the 15% over and above. If you have Plan F or the next plan is Plan G. Just a quick explanation. The government designs these supplement plans. They're not designed by AARP. They're not designed by Blue Cross. They're not designed by Aetna. They're designed by the federal government. So, and they give them letters. So Plan F is a Plan F, whether you buy it with Blue Cross, you buy it with AARP, you buy it with Aetna, you buy it with Mutual of Omaha, you buy it with Cigna. We like dealing with the top Medicare supplement companies in the United States. AARP, which is United Healthcare, they're the largest in volume. Aetna is the second largest. Mutual of Omaha and Cigna are right behind them. So those are all A-rated companies, and they're the biggest in the country. So, we deal with the other carriers too, but we don't deal with any B-rated companies at all. We just deal with the major players in the Medicare supplement arena. All right, so this is the plan that now is the best plan. If you're turning 65, this is the best plan you get. There's only a minor difference over the Plan F. Your in-hospital service is identical. So you're 100% covered, the same as an F. Skilled care, 100% for 100 days. The only difference is that you have to pay the Medicare deductible, which is $203. So you start going to the doctor, you start getting tests done, and you're going to get balance billed $203. And then once you pay that, you got the exact same coverage as a Plan F. Our friends in Washington decided this in 2015. They said, this Plan F, it's so rich. You go from doctor to doctor to doctor, and you don't pay a dime. So we have to put some skin in the game where it costs you money. So they said, as of January 1st, 2020, no Medicare supplement can cover the Part B deductible going forward. Big deal, $203. That's your only medical out of pocket. And then you have 100% coverage. In this day and age, with people having $1,000, $2,000, $3,000, $4,000, $5,000 deductibles on their group health insurance plans, and they hear 203, nobody really objects to saying, I have Medicare supplement. I have a Plan G myself. My wife just went on it, put her on a G. My friends all have Plan G. And, I know when I use it, I'm going to get billed. I did an MRI last year. I had to get surgery on my arm. Doctor says, get Doug approval for an MRI. She says, he doesn't need approval. Doug, here's a script. Go with the virtual hospital. I get balance billed, the deductible, pay the deductible. and the doctor has to do surgery. Get Doug approved for his surgery. Doug doesn't need Doug, 7 o'clock in the morning, be at the surgery center. You don't need approval, just show up. The anesthesiologist, the doctor, the surgical center, all covered 100%. I met my deductible. I didn't pay a dime the rest of the year. Went for physical therapy, didn't pay a dime. I was walking in 3 times a week to physical therapy. I didn't pay a dime. People with Medicare Advantage paying $30, $40 a visit. You know, when you pay $30, $40 a visit, you might say to yourself, maybe I don't need so many visits, you know, but with me, I wasn't paying, so I went 2, 3 times a week. So that's G, and that's today the best plan for new people turning 65. Plan N came out in 2010. You have to meet the deductible on Plan N, and then you will have co-pays of $20 or $50 ER, $20 at your doctor's, up to $20 at your doctor's, and then up to $50 at the emergency room, and it does not cover excess charges. So this plan could save you $35 a month if you want with an N versus a G. People say, well, you know what? I don't go to doctors more than a couple of times a year. And I always relate it to the fact, well, you need a knee replacement. You got to go 3 times a week for physical therapy. You know, you got all these $20 visits. You know, so that's G makes it nicer from that standpoint. And the only other time that I've seen this where it was a negative is I was writing a plan G for a woman, and her husband, 10 years older, had a ARP plan. I said, he said, boy, the G sounds good. I said, well, what do you got? He says, I got a plan N with United Healthcare. I said, N's good. There's nothing wrong with it. He said, no, it's going to cost me $300 to $400 a month in copays. I said, well, how can it cost you $300 to $400? He said, I had a stroke and they want me to go for physical therapy, speech therapy, and occupational therapy. I ended up all these therapies 2, 3 times a week for each of these therapies. He says, it could be $300 to $400. And it's like, my jaw dropped, because you don't think of this happening to you where you could maybe need to go 10 to 12 times a week for different therapies at $20 a pop. So again, I mean, just pointing these things out to you, because people that say, hey, I never see a doctor, I'm healthy, you know, think down the road, 3, 4, 5 years from now, nobody knows, nobody can predict the future. That's my attitude. I very seldom see doctors. I don't take any medications. I go to the gym 3, 4 times a week. I try to stay in shape, but I can't predict what's going to happen to me in the future. So, you know, I want to be fully covered. So when can you get a Medicare supplement? When's the best time? The first 6 months that you get your Part B is open enrollment to get a supplement, and nobody can deny you. You can buy whatever you want in the first 6 months that you get your Part B. So you'll be 70 years old, you get your Part B for the first time, you can buy it. If you're 70, you can get an F, a G, an N, whatever you want, you can get. If you're disabled and you had Medicare prior to age 65, you can get a chance to change your supplement at age 65, because you can get another new open enrollment period at 65 years old. So that's another opportunity for somebody on Social Security disability. All right, I'm going to turn it over to Justin now. When we do these, I used to love doing these things in person, because I always say gives the old man a chance to sit down and let the young guy come in. Justin has been very involved working with the Centers of Medicare and Medicaid Services, and also Health and Human Services. He developed the Medicare, helped develop it with them, because the Medicare Plan Finder was so screwed up 3 years ago, 2 years ago, 3 years ago, because they took it over. The federal government said, we could do this instead of paying an outside company to do it. And it was totally screwed up. And Justin got involved and had seminars twice a week with CMS and HHS. And he conducted the seminars, told them what they had to do. And to this date, if something's wrong, a couple of weeks ago, there was a problem with the Part D drug plan finder. Call up Justin. I said, Justin, it's not working. He sends an email to CMS. CMS says, thanks, Justin, we're looking into it. And the next day, Justin gets an email back from the Centers of Medicare Services, says, Justin, it's been fixed. There's not another person in the state of New Jersey, not probably another agent in the United States that has that type of connection, because they deal with most of the major players, United Healthcare, CVS drugs. And Justin's been invited down to meetings with them in Baltimore, and he's the only agent. So I just want to let you know that, I'm very proud of what he's done, and you have great resources here if you ever need help with anything. So I'm going to turn it over to the younger guy right now to take it over.
Thank you. Thanks for the intro, and thanks for the the first half of the presentation. I just want to remind everyone again, if you have any questions, you can type them into the Q&A window in Zoom. We've covered a lot of ground, so you feel free to type any questions on anything that we've covered so far. We covered high level the different parts of Medicare, when you should be signing up for Medicare, how much you pay the government for Medicare. If you're in a higher income bracket, how much you pay. We also went over the differences between Medicare supplements and Medicare Advantage plans, and the most popular supplements that are out there, the Plan F, the G, and the N. So feel free, if you have any questions, you can type them into the Q&A window. We are going to move along to the Part D prescription drug coverage. And for this piece of the Medicare puzzle, there's about 30 different plans available in each state. And there's a tool on Medicare's website, which we're going to show you for how we pick the Part D drug plans and identify the best one based upon your list of medications. But before we do that, I just wanted to show the rules that all of the Part D drug plans must follow. So these rules on this slide are for all of the 30 different drug plans that are out there. The first rule, or step, if you will, is the deductible. So these drug plans for Part D can have a deductible, but it can't be any higher than $445. Okay, so that's defined by the government. And that changes each year. It tends to go up a few dollars, $10, $15 a year, roughly on average. If your plan has a deductible, it says member pays all and the plan pays nothing. Well, it's not exactly true. A lot of these plans have a deductible that only applies to higher tier drugs. So if you have low cost generic drugs, in a lot of cases that deductible won't apply. You might still have a zero copay for your drug, even if you have a deductible on your plan. So that's generally for the higher tier drugs, the expensive drugs where that deductible would come into play. After the deductible comes the initial coverage level. And while you're in the initial coverage level, you're going to pay a copay or coinsurance for your drug. It's going to be similar to like a group insurance or under 65 individual insurance. You pay a $5 copay, 10, maybe you have a $40 copay. It just depends on the drug, but it's going to be a set fee or copay that you're going to pay for your medication. And 85% of people don't get past the initial coverage level. So the large majority of people, even on Medicare, if they are on medications, they're generally relatively inexpensive. As long as the drugs are less than $4,130 based on the retail cost of the drug, you're just going to pay that copay or coinsurance, and you're never going to get past the initial coverage level. Again, that's about 85% of Medicare beneficiaries. If, however, you're on very expensive medications and the full cost of the drugs exceeds that $4,130, again, this is not what you're paying for the drug. This is the full retail cost. If it exceeds that $4,130, you fall into this coverage gap. It's also referred to as the donut hole with Part D of Medicare. And if you hit the coverage gap, that's when you have to pay 25% the cost of the drug. All right. So, and this, I know this can be confusing, so I'll give you just a quick example to help explain this coverage gap and how it works. And basically, if you take any drug that you see a commercial for, those are the expensive drugs. Those are the brand name drugs. They don't have generic alternatives. And those are the ones that you're going to be hitting this coverage gap or donut hole for. A common example is a heart medication called Xarelto or Eliquis. Those are both heart medications. And the retail cost of those drugs is about $500 per month, maybe a little over $500 a month. All right. So if you're, let's just for simplicity, let's say you're taking just one medication and it happens to be Eliquis. And again, it's about $500 a month retail. Let's say your copay is with your plan is $45. So for that drug, you may have a $45 copay. All right, let's assume you don't have a deductible just for simplicity. So for January, when you go to pick up that medication, the Eliquis, you pay the $45 copay. You're in that initial coverage level. February, $45. March, $45. April, May, June. You get all the way now into September, and you go to pick up the same medication, and the pharmacist says that'll be $130. And you say, no, it should be $45. That's my copay. What happened is once you get into September, you're now 8 months into the year, right? August is completed. So 8 months times the $500 roughly a month retail cost is over 40. Now you've exceeded the initial coverage level. That 4,130 is now exceeded, and now you're in that coverage gap. So now you have to pay 25% the cost of that drug. So again, 25% of 500 plus is roughly call it $130 for that refill. So basically you were paying $45 a month, and now you hit the donut hole or coverage gap. Now you're paying $130 for that same medication. All right. So that's how the initial coverage works, and that's how the coverage gap. That was a simple example with one medication, but if you have multiple medications, it's the total cost of those drugs. Once that exceeds $4,130, that's when you reach that coverage gap, when you have to pay 25%. All right. There's also protection on the other side of the coverage gap called catastrophic coverage. And that's there to protect you so you're not stuck in that coverage gap for the entire back half of the year, paying 25% of the cost of the drug. So if you have very expensive drugs, you're going to be in the coverage gap for a period of time, and then you will reach catastrophic coverage where you only have to pay 5% the cost of the drug. All right. So not to be further more confusing, but the way to get from the coverage gap into catastrophic is based upon this. It's called true out-of-pocket costs. So it's retail costs to get into the coverage gap, and then it's true out-of-pocket costs to get out into the catastrophic level of $6,550. That doesn't mean you're spending $6,550 on your drugs, because true out-of-pocket cost includes everything you've spent for your medications, plus it includes the pharmaceutical discount for brand name drugs while you're in the donut hole. All right, so I don't get too tied up in the definition, but if you're looking for rough numbers, if you have expensive drugs, most people will pay out of pocket about $1,500 roughly to get into the donut hole, and then they'll probably pay another $1,500 to $2,000 to get out of the donut hole and get into catastrophic. So you're not actually spending $6,550 before you get to that 5%. All right, I know that can be confusing, so hopefully that helps simplify it a little bit. We're going to do a live example on the Medicare Plan Finder, and you're going to see some of these terms on the Plan Finder and the tool that we use. So that's why we wanted to show you how this works before we get into the actual demonstration of the Plan Finder. All right. So if there's any questions on that, again, you can type them in the Q&A window. Otherwise, we will move along to the demonstration of the Medicare Plan Finder tool. So I'm just going to stop sharing my slides, and I'm going to share my web browser. Give me 1 minute here. All right, the tool I'm going to show you, this is available to anyone. And basically, it's right on the Medicare website. Let me see if we can share this. Here we go. That's the PowerPoint. And they just changed this today, actually, the look and feel of the website, but it should still be similar. So I hope you can now see my screen with the Medicare.gov website. And basically, the Medicare Plan Finder tool is going to be this button right here. It says Find Plans. It's right on the Medicare.gov website there. And you click that button, and then you get a screen that looks like this. And this is part of the newer functionality they released a couple years ago, where you can actually log in to your MyMedicare.gov account. And the advantage of using that to do your search is it will store your drug information, so you don't have to keep re-entering it in every time you run the analysis. So if you have an account, you can use it and keep that information stored. For the purpose of this example, we're just going to continue without logging in. And we are going to search for, the first question is what type of plans? We're going to look at Part D, drug plans. You could use this tool to look for Advantage plans as well. For the purpose of this example, we're looking at Part D drug plans. I'm just going to put in our office zip code here in Cranford. And then it asks if we get any extra help from any of these programs, generally for like lower income, Medicaid, and so forth. I'm going to say I don't get any extra help. Click next. Do you want to see drug costs when you compare plans? Yes, that's why we're using this tool. How do you fill your prescriptions, retail or mail order? We're going to say both. And next. Now here's where you enter in all the drug information. For the purpose of the first example, I'm just going to use two inexpensive generic medications. One is a blood pressure medicine, amlodipine, very common medication. We'll just take, you can set the dosage after you enter in the name of the drug. We'll take the lowest dosage once a day, add that to my drug list. And I'm going to add another drug here. And if you notice, when I start typing the name of the drug, if I forget the name of it or how to spell it, once you start typing a few letters, you can see it pre-fills the spelling, gives you different options there, which is helpful for some of those drugs that are difficult to spell. This is the second drug we're going to enter, which is a cholesterol medication. This happens to be the brand name. Crestor is a very common brand name cholesterol medication. If we enter in the brand name, this tool is going to tell us if there's a generic available, that there's going to be a lower cost alternative. So when we add that drug, it tells us a generic is available. This is the name of the generic. Would you like to add the generic instead? And for the purpose of this example, we're going to use the generic. And here's why. Generally speaking, if you're taking a drug that's a brand name and there's a generic available, none of these Part D plans are going to cover the brand name. Okay. There are a few exceptions to that, but generally speaking, if there's a generic available, the brand name drug will not be covered. All right. So we're going to add the generic. And we'll take 5 milligrams of that once a day. So it's 30 per month, and then add to my drug list. So now my drug list is complete. For this example, it was one person. He's taking blood pressure med and a cholesterol medication. The next screen, we're going to select our pharmacies because every one of these Part D plans has a different network of pharmacies and different costs for drugs, depending on whether you go to their preferred pharmacy or standard pharmacy and so forth. So we're going to select a couple of local pharmacies, and we'll take a Walgreens and a CVS, more of a national brand, so you can see the differences. And we'll also leave in mail order. You can have up to 5 different pharmacies, but mail order counts as one of them. So we get 4 pharmacies and mail order. Okay, now the tool is doing all the work for us. And this is really the magic in this tool, which is figuring out for those 2 medications and those pharmacies, what is the total overall expense for the rest of the year for each of these 30 different drug plans. So that includes the premium for the plan plus the cost of the drugs. And then it sorts the list based upon the lowest drug and premium cost for the rest of the year. So we're not picking these plans based upon just the premium. We're not picking it based upon just the copay. We're looking at the total cost to figure out which is going to be most cost effective. So this plan that came to the top of the list for these 2 drugs in this situation would be most cost effective. It's called SilverScript Smart RX. It happens to be an Aetna drug plan. The premium is very low. It's $7.30 a month. And it does have a $445 deductible. All right. But the way we're picking these plans, we're getting some, if you have questions, please use the Q&A, the Q&A function. I think we're getting people that are typing in some chat, but the Q&A is where we'll see the questions. But back to, so the $7.30 a month is the premium, and then the $445 is the deductible. But the way we're picking these plans is the total cost for the year, which is this $58.40 is the total for the year. That's the premium plus the cost of the drugs for the remainder of the year. This is always looking at the first of the next month. So this model is based on May 1st, since we're running this in April, May 1st through the end of December, that's the total. If we scroll down through the list, the next one would be $140 total. You can see the premium's higher, but that's not how we're picking the plan. It's just what this total cost for the year, 177. You keep going up, 200, 224. On the bottom of this first page up to 291. If we go all the way to that third page, because there's 30 different, there's 10 on each page. On the third page, if you go to the worst possible plan for these drugs, it's this Mutual of Omaha plan. It's $97 a month in premium, but the total for the rest of the year is over $1,000. So you have a higher premium and higher drug costs for this particular plan with these medications. So some people think, oh, I'm paying more in premium, I'm getting a better drug plan. It doesn't work that way. It's very specific to your medications as far as which is going to be the most cost-effective drug plan for your situation. So I'm just going to go back to this first plan again and give you a little more detail so you can see, what's behind some of these numbers. So you hit plan details and it gives you a lot of good information. Again, the premium, $730 a month, the deductible of $445. Gives you the tiering of the drugs, what the cost is for the 5 different tiers of drugs on this plan. It tells you for the pharmacies, which of those pharmacies are in network versus out of network, which are going to be standard versus preferred. So for this particular plan, this Bell's pharmacy is in network, but it's a standard pharmacy. The Walgreens and Barron's will be out of network, so you wouldn't be able to use it. And the CVS is preferred in network with this plan, which means you're going to get the lowest copays at that pharmacy. All right. So I'm going to scroll down to the CVS. Each one of these pharmacies are going to repeat here, and you're going to see the cost of everything for each of those. But I'm going to go down to the one that's preferred, which is right here, the CVS costs. And you see each of those drugs, show you the full retail cost, the cost before deductible, cost after deductible. If you reach that coverage gap, how much you pay. And if you reach catastrophic, how much do you pay? Now, all tier 1 generic drugs on this plan have a 0 copay at CVS or mail order. So you'll see that cost before deductible is $0 for these 2 drugs. They're both tier 1 generics. So it shows you, and then it shows you by month what your copays are. They're $0. There's no cost for these drugs with this plan. So the only thing you're paying is that $7.30 a month times, 9 months left in the year or 8 months left in the year, which is how you get to the $58.40. So that's where that number comes from. Remember, that's how we picked the plan is that total number for the rest of the year. This plan would only be $58, which is just that premium of $7.30 a month because the drug copays are 0. All right. So this is a very simple example with 2 very inexpensive drugs, as far as which is going to be the best drug plan for that individual. If we add in, I'm going to go back to the drug list and add a more expensive medication into here so we can see what that would do to the model. So let's add in the Eliquis that I mentioned earlier and see what that will do to the model. Let's say you take 5 milligrams twice a day, which is 60 per month, and we add that to my drug list. All right, so now we've added an expensive drug. Let's see what that does to our cost as well as the plan. Maybe it gives us a different plan. Maybe it gives us the same plan. Let's see. So it's recalculating everything for each of those 30 plans now based upon the new drug list that we just added the Eliquis into. And now we have a new plan that's showing the lowest cost for the year. This is a Blue Cross Blue Shield plan. It has a slightly higher premium, $23.50 a month. It has a $150 deductible, so it's a lower deductible with this plan. But that's not how we're picking the plan. Remember, it's this total number. So for the rest of the year, May through December, the total cost for this individual's drugs is going to be not just the drugs, the premium plus the deductible plus the drugs is going to be $750 with this plan. All right. If we go down to the next plan, this Express Scripts one would be $896. The next one, $914, $932, and so on, $993. If we go all the way down to the third page again, and let's see what a difference it makes now if we pick the wrong drug plan. This one happens to be this AARP Walgreens plan, which it's showing $5,000. So that's a difference of over $4,000. And the reason is if we click on the plan details, we'll see that Eliquis is actually not even covered on that plan. So that, $400 or $500 a month times 8 months of that drug is how you're getting up to that $5,000. All right. Here's another one where that one wouldn't be covered, and so forth. So if we jump back now to that first plan, and we can jump into more detail on that plan with the Eliquis with the Blue Cross. This plan, again, it's $23.50 a month in premium, and the deductible is $150. Now, the pharmacies with this plan are all in network, but they're all standard. They don't have any preferred pharmacies with this plan, which makes it kind of simple. You just, the pricing is going to be the same regardless of which of these pharmacies you use. But let's go back down to CVS, since that's what we were looking at earlier. And now we're looking at this new plan. And now you see there's a retail cost for each of these drugs, $5, roughly $500 for the Eliquis, and then the Crestor generic, $6 retail. So the cost before deductible, and this is a little misleading because the deductible is only $150, but the point is you're going to pay the full cost up to that point for these higher tier drugs. So you'll hit that deductible in May with just the one filling up of the Eliquis. You'll hit the $150 deductible. After the deductible, it's a $45 copay for the Eliquis, $0 for amlodipine, and $6 for that Crestor generic. All right. So your total copay is about $51 a month with this plan. So you can see that first, it breaks it out by month. That first month, you're paying the $150 deductible plus the $51 copays, and you're at about $200. And then each month thereafter, you're just paying the $51 per month. And we actually do not reach the coverage gap. Just because there's only 8 months left in the year, we're going to be right on the border of that. If you multiply the 510 times 8 months, you're right around $4,000, a little over $4,000 in total retail cost. Remember, the threshold was $4,100 in retail cost. So this person just barely misses the coverage gap. If they were to reach the coverage gap, you would see that the next month their drug costs would go up to this $127 or $124 for the Eliquis and $1 for the other two, for a total of $127 is what they would have to pay if they had another month in this year. Again, that's because there's 25% the cost of the drugs while you're in that coverage gap. All right. So I know that can be confusing. I hope the examples helped a little bit there. Let's see. We did get a question come in. Here's where you used to be able to go back to enter other drugs or change pharmacies. They took that away. So that if you want to change drugs, if you just scroll down to the drug list on the report, you can click edit and remove drugs, and it takes you right back there like we did before. That's how you can change the drug list that like we just did and added in the Eliquis, but you can also remove that. You can edit the drugs here, but there is that button there on the plan details page. So any other questions on the Medicare Plan Finder, these Part D drug plans? Feel free to type them into the Q&A section. All right, I'm going to go back now to my slides to wrap up some final slides here. All right. So hopefully you can now see my slides again. All right, we're going to quickly recap now the top 5 mistakes that people make on Medicare. So hopefully you can avoid these mistakes. The first biggest mistake we see people make on Medicare is not enrolling in Medicare Part B on time, okay? Remember, you have that 7-month initial enrollment period when you turn 65. If you do not have credible group coverage, then that's the time you have to enroll in Medicare to avoid any penalties or delays in your Medicare coverage. There's also that COBRA trap that we discussed a little bit earlier, where if you're leaving work after 65, you have to sign up for Medicare A and B because it's going to become your primary coverage. Even if you take COBRA, COBRA would be secondary to Medicare, and you would have delays and so forth in your Medicare Part B if you do not enroll in Medicare when you leave active employment. So, this is the number one biggest mistake we see people make on Medicare, is not enrolling in Part B on time. The second biggest mistake we see people make is not analyzing their prescription drug cost. This could cost you thousands of dollars per year if you pick the wrong drug plan. We just looked at a couple of quick examples where, picking the best plan versus picking the worst drug plan, would cost a difference of thousands of dollars. So it does happen. And, you should be looking at this when you first go on Medicare, but then also every year during the open enrollment, October 15th to December 7th. That's your one opportunity each year to change your drug plan for the following year. We send out reminders to all of our clients in September of each year to get their latest drug list and to rerun their drug analysis to make sure they have the right drug plan for the following year. Even if their drug list does not change, these Part D plans do change every year, and it may be better for you to switch to a different plan for the following year. So it's very important. The tool we use is the Medicare Plan Finder tool, which is available to anyone. You can do this on your own, like we just showed, or we can do that for you. It's right on Medicare's website. The third biggest mistake we see people make on Medicare is not understanding the difference between Medicare Advantage and Medicare supplements, two very different types of coverage. Remember, the Advantage plan is the fully privatized option where the insurance company takes over and fully manages your benefits for you. When you sign up for that Advantage plan, you are no longer on Medicare. All right. Now you're being fully administered by Blue Cross Blue Shield or Aetna or United Healthcare, whatever carrier you sign up for. All right. With a Medicare supplement, you're just supplementing Medicare, right? So you're still on original Medicare that's paying the first 80%, and the supplement will generally cover the other 20% of your expenses. So you're still on Medicare when you go with the supplements, okay? The premiums, again, are generally going to be higher on a supplement. You're going to pay a monthly cost for the supplement. With the Advantage plan, most people that take the Advantage plans go with the zero premium plans, but you have up to $7,500 a year out of pocket expense on the Advantage plan, where the supplement you have very few to $0 out of pocket expense per year. Some of those Advantage plans can offer extra benefits, things like dental cleanings, vision exams, meals after a hospitalization, free rides from Joe Namath. I'm just kidding there, but Joe Namath loves to pitch these Advantage plans. But they do offer extra benefits in these Advantage plans that they don't offer with original Medicare. So, but we really look at the overall picture, and we want to make sure people are picking these plans based upon the medical coverage, which is really the main important part here of Medicare. This is the third biggest mistake, again, people not understanding these differences between Medicare Advantage and Medicare supplements. The fourth biggest mistake we see people make is not analyzing their retiree coverage. There are some cases out there with companies that still have decent retiree plans. They're few and far between, but there are still some out there where you should stay on the retiree plan. However, there's other cases out there where people are paying a lot for their retiree benefits, or the coverage isn't very good, or both, and they can do better off on their own, getting their own individual plans and saving in premium, or just getting better coverage for the same premium. And a lot of people think they have a retiree benefit, so it must be good, but it's not always the case. So not analyzing and comparing your benefit with retiree plan to getting something on your own is the fourth biggest mistake we see people make. And the fifth biggest mistake, we joke about this, but we see it all the time, is listening to your friends and family. And we see this with the drug cards is one prime example, where it really doesn't matter what your friend or spouse or neighbor or cousin has for their drug plan. Unless they're on the exact same medications as you, you really want to pick the plan for your specific situation. Medicare is individual coverage. There's a lot of misinformation out there, a lot of confusing information out there, and non-compliant marketing out there. So you definitely want to do your own research, talk to an expert in this space that can help with your Medicare planning. And that's it. Those are the top 5 mistakes people make on Medicare. We hope that you have enjoyed this presentation. Again, if you still have questions, we'll hang around for a couple minutes. You can type those into the Q&A window. if you're interested in getting our future updates, we do a lot of videos and a lot of blogs and newsletter updates. You can subscribe to us on YouTube, follow us on Facebook or LinkedIn to get our updates as they come out periodically throughout the year. So again, we hope you enjoyed this. If you have any questions or need help with your Medicare planning, you can reach out to us. You can, there's no fee, as Doug mentioned earlier, to work with us. So you can reach out to us at any time. And if you have just general questions, you can call us or email us, or you can find contact information on our website as well. And we'd be happy to help you with your Medicare planning. So we have another question. Oh, thank you, Lubino Brothers, was Bruce's comment. Yes, brother Doug and Justin.
Hey, yeah, I want to just thank everybody else for joining in today. We had a nice group out there, a large number of people. And American College, we had several employees from the American College, so thank you. We do have a question, Justin, quickly.
Yeah, I saw this came in. Elaine just asked, I am covered under my company's health plan, but enrolled in Medicare A when I turn 65. When I leave the company and enroll in B, will I be subject to the months of waiting for it to begin? So the short answer is no, as long as you're past the 3-month window we discussed earlier after your 65th birthday. So that delay we discussed earlier with the Part B effective date only occurs in those 3 months after your 65th birthday. So if you're 67, 68, 70, whatever, and you're enrolling in Medicare Part B, you're coming off of that group health plan, you're going to need those forms that we talked about earlier, which the enrollment in Part B form and the employment information form that gets filled out by your employer showing that you were covered on the group plan since you were 65. And that is how you avoid any penalties or delays in your coverage. And you can start the first of the following month. So, in theory, if you wanted May 1st right now, you could still get a May 1st effective date if you submitted those forms in the month of April. We don't recommend, last minute like that, but it is possible as long as you submit those forms before the requested effective date. I hope that helped, Elaine.
All right.
All right.
Is there another question, Justin?
No, she just said thank you.
Okay. All right. Okay. Thank you, everyone. And again, feel free to give us a call if you have any additional questions that you want to follow up with us, and keep us in mind when the time comes. Thank you very much.
Thank you all. Take care.